to thank you all for coming to my final ISM presentation. So first I'd like to introduce Dr. Shipley. She's my mentor. She's been great and very helpful, and she's a veterinary cardiologist here at Bay Area Veterinary Specialists. And this is Stephanie, her vet technician. And this is one of my student peers, Erin Bennett, and then Bailey Miller, Shanina Momin, and Summer Faruqi. And this is my ISM teacher, Mrs. Nyland. So over this semester I've been developing a brochure, and this is my product. And this is about diagnosing heart problems in dogs and cats. So I'm going to pass one out to each of you. So feel free to follow along as I talk about stuff. And so first I'm going to begin with how a veterinary cardiologist does a physical examination. So if you open your brochure to the inside, this is where I'll be talking about this information, so you can follow along if you'd like. First, it's very important to obtain the medical history of a patient and get to know what they've been through as far as health issues and medications that they've been on or are currently on, because this can factor into any medications that a cardiologist will put them on, or treatments and surgeries. So, first, I'm going to, oh, and this is Maxwell, by the way, our pretend patient for today. So, come here, Maxwell. So first I'm going to start by observing the mouth, and I am pressing the gum here to make sure that it responds with a pink color. And I'm also going to pry open the mouth and make sure that the tongue is pink. And this tells me that Maxwell is receiving good circulation throughout his body. He's getting enough blood and oxygen to his tissues. So next, from the mouth, I'm going to feel for the lymph nodes under the jaw behind the head. Make sure that they're not enlarged. I'm also going to feel for them in the shoulder blades and on the back legs behind the knees. And while I'm with the back legs, I'm going to feel for the pulse here. And this is where the femoral artery is located, and this is like the best place to feel for a strong and steady pulse. So Maxwell has a good pulse. And next I'm going to feel the heart with or where the heart is located with my fingers. And make sure that there is no vibration against my fingers, because that would suggest a severe grade 5 heart murmur. And I'm also feeling for wherever the heartbeat is strongest. And wherever the heartbeat is strongest, I can usually hear it the best with my stethoscope. So now I'm going to auscultate the area where the heart is with my stethoscope. Here, Maxwell. We're not done yet.
Yeah, you just leash towards you.
So whenever I'm listening to his heart, I'm listening to blood flowing through the valves as they open and close. And this is what creates the lub-dub sound that you typically hear a heart make. And so there are 4 valves. There's the mitral valve, the tricuspid valve, the aortic valve, and the pulmonic valve. And if I hear any abnormal noises like a clicking or galloping or swishing noise, then that indicates heart disease. And with my stethoscope, I can also make sure that Maxwell has a good heart rate. So I'm listening to the different areas of the heart. And Maxwell has a good heart, so. Also, I'm going to use my stethoscope to auscultate the lungs. Make sure that as Maxwell takes breaths in and out, the lungs sound clear. And if I hear any crackling, then that means that there is fluid buildup. And so. Alright, good job, Maxwell. So Maxwell seems healthy. So that was about the physical examination. The next step in diagnosing heart disease would be if you open your brochure, this side there's information about electrocardiograms. So a veterinary cardiologist will obtain an electrocardiogram, which is a graph of the electrical conduction that the heart gives off as it pumps blood. So basically, as you can see in your photo, I'm going to use this one because it's understand what a regular heart rate looks like. And basically, these are all complexes, which each one represents a heart cycle. And they should all be relatively the same size and equally distant from each other. So as you can see here, this complex is significantly larger than the others, and it's also farther apart from the rest. So that indicates an arrhythmia, or an irregular heart rate. And each complex consists of several waves. As you can tell, it's like one complex. And each of these waves has a unique letter assigned to it, so P, Q, R, S, and T. And each P, Q, R, S, T wave is, as you can see on your brochure, associated with a certain part of the heart. So, for example, on an electrocardiogram, if we're missing a P wave in one of our complexes, then the cardiologist can determine, well, there's a part of the heart that's not pumping properly, or there's a valve that's dysfunctional. So, any questions about electrocardiograms or physical exams before we move on? So another thing that a cardiologist will do is an ultrasound. And this is an ultrasound machine. So as you can see on your brochure, there are two pictures on the very back. And the top picture represents a pet with an unhealthy cardiac system. And the bottom is a picture of a pet with a healthy cardiac system. The difference is that, for example, on the top, this mushroom type shape is representing the left ventricle, and above it rests the right ventricle. So as you can see, the left ventricle is enlarged, as opposed to the bottom picture's left ventricle. Also, on the bottom picture we see waves, and those waves mean that the heart is contracting and relaxing consistently, which is good. We want the heart to contract and relax. Whereas on the top photo it's smooth, and that means that the heart is not pumping like it should be. So this is basically like a support table that we place the patient on, and this hole is where we take the ultrasound's probe and we press it against the patient's heart, and then we receive multiple images, so we can see different views of the heart. As you can see here, we have the left atrium, the mitral valve, the left ventricle, then the right atrium, the tricuspid valve, and the right ventricle. And so this shows us the different chambers in the heart, and we are able to see it. Are they enlarged? Is the valve, is something wrong with it as it's opening and closing? And we use a color Doppler. So you can see red and blue right here. That is representing normal blood flow throughout the heart. And each color represents a different direction of blood flow. If we see green, that means that there is backflow or regurgitation in the heart. So that indicates that something is wrong with like a valve or something. So that's information about the ultrasound, and I'm going to briefly discuss x-rays before we take a tour of the clinic and you can actually see an example of an x-ray. So if you open your brochure to where we were with the physical exam, there's information about x-rays right here. And there are two pictures. First I want to show you, because I know for someone who's never seen an x-ray, it's hard to tell, well, what are all these structures and why is it light and dark? So I'm going to explain. This light structure here in the very center, that is the heart. And the dark area around it is the lungs. And this should be dark because lungs should only have air in them, no fluid, which would show up as a light color on an x-ray. And this dark tube feeding to the heart is the trachea. And I also want to mention that this is an x-ray of a cat on its side, and its head is facing this way, and its rear is facing that way, so you can kind of tell like where everything is based off of that. And so that is of a cat with a healthy cardiac system. The bottom picture, however, is of a cat with chronic heart failure. And this we can tell because the heart is enlarged, and there's also a lot of light coloring, which represents the fluid buildup that is associated with chronic heart failure. And this light coloring can also represent infection. So basically, x-rays allow us to tell if there are abnormalities with other structures, maybe cardiopulmonary related structures, and especially the heart. We can also tell if there's fluid accumulation with an x-ray. So now I'm going to give you all a tour of the clinic.
What does the black mean?
The black would represent air, whereas light coloring would represent something other than air, like fluid or infection. And there should only be air in the lungs. So when you look at the lungs, they should appear dark, as you can see. Any other questions?
How do you know if, like, your dog is having any kind of problems?
Sometimes dogs will cough, or whenever they'll have trouble breathing, labored breathing, and if they have a severe heart murmur, you can even feel it with your hands or fingers, and they may have trouble exercising, so you may see like a lack of exercise. They may be lethargic. Any other questions? No? Alright. Well, let's take a tour.
You stay here.
So follow me. Ooh. Watch your step. Oh. So this is the back half of the clinic where everything is done.
Hello, everyone.
This is Dr. Lenny. She specializes in internal medicine and cardiology.
Nice to meet you guys.
So,
And we don't go on Facebook, by the way.
Oh, no. Okay.
Is the surgery room.
Yes, it's open. You can take them back there.
Alright, so first I'll show y'all where surgeries occur. So this is this is a lead gown, and this is what they use to prevent themselves from getting radiation. And if you come in here, this is the actual room where Dr. Shipley will do surgeries. And so this is like a giant x-ray machine, whereas the difference between it and an x-ray machine is where it takes multiple images, whereas a normal x-ray machine only takes one image. So we can see several places of the heart. And this is from a surgery where the dog had patent ductus arteriosus. And so you can see the contrast fluid is highlighting the vessel where she was doing the procedure. So yeah, it's a surgery. And this is basically another ultrasound. So we can also do ultrasounds there. And you can see all of these pages. This is where inpatients are kept, so if they stay overnight or even during the day, that's where we'll put them. And also there's pages in there. And this is basically where I've learned a lot about taking blood and putting in catheters and blood pressure, and they do a lot of work with animals here. So if you'll come this way, you can see the x-rays. So this is the EKG machine. So this is what gives us the electrocardiogram. So in here, this is where we take x-rays. And normally I'm not in here, but this is where the x-rays are taken. And behind this wall is where we will analyze the x-ray. So you can come over here and get a better look. So this is an x-ray of a patient, and basically this is called the vertebral heart score. Oh, and I want to mention that the dog's head is facing this way, and the rear is facing that way. This is the trachea feeding to the heart. That's the heart. And then we have the lungs behind the heart. So what we will do is we will measure the long axis and the short axis of the heart. And then we'll take those measurements and we'll compare them to the vertebrae of the patient. And then we'll count how many vertebrae fall within those measurement lines. This gives us a total sum called the vertebral heart score. And usually with dogs, it should be 10. Whereas with this patient, it's about 13, which is high. So the heart is enlarged compared to the dog or cat's body size. So, any questions?